Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Episodes are available on vhha.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, the Virginia Audio Collective, and the World Podcast Network. Episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 820 AM across Central Virginia, 1650 AM in Hampton Roads, 105.1 FM and 1050 AM in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. Today, we're delighted to be speaking with Carli Holtzhauer, a Carilion Clinic child life specialist, who joins us to talk about her professional journey, Carilion's new Fun on Wheels program, and more. But before we do that, welcome to the show, Carli. Thanks for joining us.
Thanks so much for having me.
So it's our custom on these episodes to start our conversation just by learning a little bit more about our guests. And we know you're a Kentucky Wildcat, which is where you got your undergraduate degree in family sciences. You subsequently earned a master's degree in child life services from Nova Southeastern University in Florida. But beyond that and your current role at Carlion, what else should people know about your journey and your unique personal story?
Yeah, so I learned about child life at first from being a patient in the hospital. I have a genetic disorder which made me spend a little bit time inpatient, and that was my first experience learning about these professionals who dedicate their career to helping make the healthcare environment better for children. So it has always had a special place in my heart to recognize the uniqueness of teenagers in the hospital. But outside of my professional life, I really enjoy outdoors and doing any kind of creative expression activity that I can. So I really like to pair those things and bring them into the hospital too.
That's awesome. So you said you had some kind of personal experience with it. Does that mean that going into your undergraduate time, you knew this was something you wanted to pursue, or when did you sort of discover that?
So I actually went into my undergraduate as a special education major and saw a posting online for a child life assistant position and wanted to make some extra money to blow through while I was, a college student. Interviewed, started working in the hospital and the child life team, and switched my major, kind of changed my life course because I knew it was something that I was really meant to do, something that was really soul fulfilling for me, and felt like I could make a difference and make somebody smile, relaxed, or make somebody else's day better every day that I stepped into the hospital.
That's awesome. That's cool. So you've been a member of the Carilion team for several years now as a child life specialist. If you would, just tell us about that role and some of your responsibilities, what all it entails.
So a child life specialist is a healthcare professional that really is there to help children cope with hospitalization. We are trained with a lot of child life theory, child development, have in-depth knowledge about child stressors and different things to support them during their hospitalization. Our job is to focus on providing diagnosis or procedural education, kind of support through those procedures to help make them the best they can be. So being there for IV sticks or labs, things that are going to be a little bit painful, and help provide some coping techniques or alternative focus, some distraction to help make kids be able to process those really hard things a little bit easier, as well as being a support for their families. We also have the fun job of being able to bring more play into the hospital. Play is great for children of all ages and adults, but we get to be able to help have access to the playroom or different play items at bedside, things to make kind of that hospital and healthcare environment a little more normal.
That's awesome. And that actually transitions us perfectly into sort of the main primary topic for this conversation, which is Carlion's new program entitled Fun on Wheels Teens Play 2. So I'll give a little bit of background information on it, and then you can kind of fill in the gaps here. So
Okay.
Carilion Children's Hospital is one of 20 hospitals in the nation chosen to receive this funding, which comes in the form of an $8,500 grant from the Toy Foundation. The program features 2 mobile play carts stocked with creative, educational, therapeutic activities, sort of like you mentioned, and games to help patients relieve stress, build coping skills during hospitalization, all the kind of things that you just touched on. So with those sort of surface level details, I wonder if you could kind of fill in the gaps and provide a little bit more information for us on the program.
So lots of times when we get donations to the hospital, they're geared towards younger age groups. So we've always kind of seen this lapse of our adolescent population who is so unique. I mean, teenagers are going through, finding their own identities. They're having really their own really well-developed interests and are often in the hospital for several days or weeks at a time. And so after recognizing this need, I worked with our Carli Foundation to develop a grant that we submitted to the Toy Foundation that was approved. And so that really supplied us with a lot of teen-geared items. We've gotten 2 3D printers that we can use in our inpatient and outpatient. We've gotten some iPads that have the Apple Pencil where we can draw and sketch and create different things that way. Little piano for kids to be able to make some songs, all kinds of different things that are more teen-minded. We have a little cool Sphero robot where you can make a little maze and ride it through the halls. Some different kind of calming lights because, sometimes those are really beneficial to kind of change the mood of the room. Basketball hoops from the doors, and then a lot of different creative and expressive art supplies.
Yeah, I saw online that, you mentioned a couple of these things, 3D printers, keyboards, microphone and recorders. If there's any burgeoning musicians in the hospital, that's awesome. Some drones, art supplies, like you said. So sounds like a really comprehensive list and something that a lot of folks, not just teenagers, could get excited about. So that's really fun.
Yeah, absolutely.
So I believe the first cart for teenage hematology and oncology patients is already in operation with plans to expand to other pediatric units. What has the patient and family feedback been so far?
It's been really positive. We've been able to bring some of the items to some of our different events that we host for our pediatric hematology oncology families, like the drone or the little robot ball. And kids have been really excited to use those, and it's great to see them interacting together with other children who have gone through or are going through the same treatment course that they are. Just another way to connect. And in the clinic setting, it's been really awesome to be able to bring like some clay to a room and create a different sculpture or a little pot to put flowers in and just get kind of hands busy and minds away from being stuck in the hospital for hours at a time.
Yeah, absolutely. Anyone who's been in the hospital, has family members who've been in the hospital, know it can be challenging, and bring in, like you said, those elements of play and levity and some fun to sort of take your mind off it, I know is extremely important for patients and their families. I wonder how, on that topic, how this program fits into kind of the broader patient-centric approach at Carilion, because I know that, the focus there is on individualized but whole person care. So it's not just the medical treatment, but expanding that treatment outside the 4 walls of the hospital and also treating the entire person. So I wonder how this program fits into that model.
Yeah, so a lot of our child life training is in that kind of person-centric, first-person and family-centered care approach. And so being able to do this and go into a room and think, what do you want to do? What do you want to create? What will make your visit stay better? And having the tools to do so is really fabulous. We can create, if you want to paint a Pokemon figurine that day, we can pick out one from the 3D printer, print it, and be able to do it at your next visit. And that's really cool. And being able to include different members of the family too, so it's everybody's, playing and having fun during that appointment.
Yeah, absolutely. Well, we really appreciate you taking some time to share more information on that program. Before we conclude, we've got a tradition on this podcast to close out our episodes by asking our guests a pair of mystery questions. So we have a list of 10 for you to choose from. So if you would, go ahead and give me 2 numbers between 1 and 10, and I'll ask you the corresponding questions before we close out.
Okay, let's do number 3 and number 7.
Okay. Number 3. What is the best piece of advice you have ever received, and why does it stick with you?
Oh, let me think. That's a tough one.
That is a big question.
The best piece of advice I ever received is probably a practice that one of my coworkers and I do together. It's kind of become our little tradition after every kind of event, challenging day, we find our win. And finding the win at the end of the day has really become a part of my own self-care practice and reflective practice where I find the win, the day was good. It doesn't matter what else happened. If there was one win, it was a good day.
That's awesome. I might take that as my best piece of advice going forward. That's really cool. I like that. Okay, and then number 7. If you could choose, and this is also a huge question, but a little lighter. If you could choose one superpower to have, or any one skill to instantly master, what would it be and why?
I would pick a skill to instantly master, and that would be to be a perfect forager, to be able to go out in the woods and know what's safe to eat and what's not. And that's because that's something that I've been working very hard towards. I love mushroom hunting and just being able to go out there, know it's safe, cook it up and eat it.
That's
awesome. I think
awesome.
would be really fun.
It feels like we could have a whole other podcast episode on your outdoor adventures. So that's that's really fun. Maybe we'll have to circle back on that. But that's really cool. I like that.
Absolutely.
And I have to say, that's a new answer. So thank you for providing that.
I don't know if it's the best answer, but it would be my true answer.
It's a great answer. True answers are the best answer. Well, with that, we have come to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you liked what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. We want to once again thank our guest, Carli Holtzhauer of Carli Clinic, for joining us today. So, Carli, thanks so much. It's been a real pleasure chatting with you.
Thanks. It was great.